Grab your favorite alcoholic or non-alcoholic beverage, drink responsibly, do not drink and drive, and join us for the latest episode of Why Complain When You Can Whine. Everything in this podcast is purely for entertainment and psychoeducational purposes only. Enjoy! Welcome to Why Complain When You Can Whine, making sense of the senseless. Join us as we attempt to make sense of toxic nonsense while drinking wine. I am Dr. Jody Larman, licensed clinical psychologist, and today I actually grabbed the wrong wine. I don't know. I wanted something cold. I just reached in my fridge and I have a Givon Chardonnay Galilee Dry White, and I think, yeah, this is a kosher for Passover wine. And that's not why I'm saying I grabbed the wrong wine, but there was one in my fridge that I wanted to get. But this is a kosher for Passover wine. Passover passed, passed over. Sorry, trying to be funny.
It's funny.
So, and my glass, and when we talk about tonight's podcast, you'll probably understand. It says liquid therapy.
And boy, isn't it true. Liquid therapy. Yes, we are going to get into this shortly. Awesome. And I am Brienne, and I am, or Brie, whatever you prefer, licensed registered therapist up in British Columbia, Canada. And tonight I am drinking not wine, but close second, apple berry hard tea.
I've heard of hard cider, hard.
Yeah, but it's hard tea. So it's called Swan Dive, but it's actually black tea. So they're real tea. So it's actually, and they're not sweetened, right? So I like these because I don't do well with sugar. It's got 1 gram of sugar in it because of my skin. And
it's a hard tea, so it's
a hard tea. So it's like vodka and actual tea.
Oh,
so nice. And it smells delicious. It almost smells like apple cider, right?
Cheers.
So cheers, right? As much as I like wine from my past, it's not that I don't drink it, but just based on the fact that that residual sugar kicks my ass in my skin department. So
hey, if I had the time today, I was just going. If I had the time, I was thinking of taking some kumquats from my backyard. What is it? Squeezing them, getting all the juice out. I can't think of the word.
Pressing them.
Whatever. And some pineapple stuff and vodka or flavored rum or something. Trust me.
That would have been delicious.
I was thinking of a drink. I didn't have the time.
Right.
So,
and why were you thinking? And why were you thinking about this drink, Jody? What led you to our topic this evening?
This is liquid therapy because I had a morning. I had a psychiatrist appointment. Yes, if you all know, because I have mentioned it on a podcast or two that I am diagnosed with bipolar 2. That is not why I had my psychiatrist appointment, but it kind of devolved into that. It was the first time I went to the psychiatrist, and he told me we had 40 minutes for history. So I was giving him my history, and he locked in on the fact that I have bipolar 2. So he kept telling me that he had to stop me and interrupt me, and I am pretty much manic. And all of this is because I won't take bipolar 2 medication, that I am unmedicated. And so this is the cause of all of the issues that I have in my life.
And this is the reason why we feel like it's imperative to re-educate people about why mental health, and depending on practitioners, or just, I shouldn't even say practitioners, it's just individual people, depending on their role, it can be so dehumanizing. And I think this is why it's so important, because I think what Dr. Larman is trying to say is that we're all on a spectrum of different mental health issues. We all are. We're on a spectrum, and we oscillate on these spectrums. I know I've said this before, and but what's really imperative, no matter how educated you are, you can still have a person who will label you and make you feel like not human, not a person. Why mental health can be so stigmatizing. It's so imperative that we get away from this modality. This is old psychiatry, okay? So there's a difference between a psychiatrist and psychologist. For those of you that don't know, a psychiatrist is a medical doctor that specializes in mental health and prescribes medication. Now, in Canada, we don't need a psychiatrist to give you psychiatric meds. You can have a doctor do this, just a regular MD. But, you know, if they don't really feel comfortable with the mental health part of it, they can refer you to a psychiatrist. A psychologist can diagnose mental health, but they can't prescribe medication.
In
So,
in the United States, there are, I think, 5 or 6 states where psychologists can prescribe medication. And at the Department of Defense, psychologists can prescribe medication. Now, other state, California, where I live, California, and probably New York, will never likely get to prescribe because the lobbying of psychiatrists is so good that they are preventing psychologists, because the only thing that separates us and them making so much more money than us is the medication.
it's a medical degree. Well, they have a medical
No,
degree.
is the ability to prescribe medication. Because if we get the ability to prescribe medication, there is no need for a psychiatrist.
But the training, though, to be a psychiatrist, you're a medical doctor.
Right, but they don't have psychology training unless they want it. They don't have to have it. Now, we psychologists, the vast majority, at least at the PhD level, I don't know at the PsyD because I'm not one, so I won't speak for them, have taken psychopharmacology classes. If we want to be able to prescribe, we have to get 2 more years, like a master's in psychopharmacology and biology, basic
To be able to prescribe
biological
medication.
stuff. Yes.
Yeah.
So that's the only thing. So I would love to go back because I've had so many biological bases. I've taught physiological psychology, so I know a lot about it. And if I were able to prescribe in California, I would in a heartbeat have gone back to get that 2-year added.
Because the pay grade changes so much. But I mean, a trained psychiatrist, though, has to go through a full medical degree. Like they have to be trained as
Right.
an actual MD doctor in all different modalities of health problems, not just
But
psychiatric health.
but they don't. And the psychiatrists that I've talked to, they don't take a lot of psychology classes. They don't learn therapy. At least out here. I've had 2 psychiatrists that were recently newly boarded. They were brand new. And one of them asked me, where's the best place to learn therapeutic practices? And
Oh yeah, no, they don't practice therapy necessarily. And
Right.
I know psychiatrists up where I am.
Yeah.
Some do. It really depends on their scope of practice and what they want to do.
Very
But
few here do, because this is the reason why very few here do. We take an hour, a 53-minute hour to make, I'm just making this up, guys, $100. They see someone for 15 minutes, $100 or $300, 15 more minutes, $300, 15 more minutes, $300, 15 more minutes, 300, 3, 6, 9, 1,200 in the time that we're making 100. And so they don't want to do therapy, because I've talked to enough psychiatrists that have told me out here in California, at least in my area, that have told me, why would I do therapy?
right.
I'm never going to do therapy
Because they make so much money prescribing drugs.
right.
Well, welcome to big pharma.
And some of them
Right?
do. Some do therapy. I think very, very few do nowadays. Some of them, like where I
know
work,
up here they do.
where I worked, they were like mandated to do therapy where I used to work. For like, I worked there for a year, and one of the psychiatrists was like, I'm never going to do therapy. Why am I doing therapy? I've never done therapy before. I'm not doing it now.
Because
So
they don't need to.
again,
They can prescribe medication and they can diagnose based on symptoms. But this is what this podcast, I think, is really what we should really delve into. And poor Jody, and I'm going to call you Jody, as much as I do refer to you as Dr. Alarman, because you deserve the respect of that title. You earned it.
but
And
I
we're
would
going to talk.
rather.
But here's the deal. Before you became a doctor, you're Jody. You're a person.
Yeah.
And I think the biggest thing, and it broke my heart when you called me this morning and you were so frustrated. Mental health is so fucking stigmatizing. Okay, from my own personal experience and what Dr. Larman is going to share with you or Jody is that just because, you know, education or not, we all have our shit. So, you know, excuse my dog. I don't know why she's barking. Bipolar is a mood disorder. Now you're bipolar too.
Yes.
Right. But when you get that label, it's dehumanizing. It makes you feel like there's something you're effective and there's something wrong with you. And as therapists, as trained therapists, so as a psychologist and as a clinical therapist, you know, our job is to not to dehumanize you. And the shittiest thing is with bad psychologists and bad psychiatrists, because here's the deal. We're all people. Just because you are educated doesn't make you good at your fucking job. And I'm going to swear because it pisses me off
And you could be
that
good at your fucking job and not have a lot of education.
well, there you
And what
go.
I
I'm
mean by
not a
that is
doctor.
master's level isn't as
I'm
much
not a
education as
doctor.
a doctorate, and you could be an
And
amazing
I know
master's
people
level
that don't even
clinician.
have a master's degree and they've got their psychology degree and they're more competent than a psychologist. I'll give you an example of a doctor in a second that I had an experience with, but we'll just focus on this for a second.
Mhm.
Don't let yourself suffer from not getting treatment or therapy because you feel like somebody is going to put you into a box. What you experienced this morning is not okay. And it's interesting because we were talking about it. Had she not said that she had bipolar 2, because he didn't even look at her records because he didn't know. And then she had to tell him it was all there. He didn't seem to be very on top of it or aware. Every single moment of her appointment, which was only 45 minutes, he
40.
attributed to that 40 minutes that she attributed to the fact that she had bipolar disorder. Oh, you're talking rapidly, it's bipolar. You're interrupting me because you're bipolar too. Oh, you cried about your son, or you mentioned the fact that, if something happened to you, and as mothers, we worry about our children. And just because she showed emotion doesn't mean that means she's bipolar, like everything. Jody, how did that make you feel?
Well, let me give you a little bit of background. I've had a great psychiatrist in the past, and he retired. Sadly, unfortunately, I felt heard. He really listened. It was fine. I didn't want medication. He knew that my bipolar 2 did not interfere with my ability in my daily life, my work, my social, anything, my occupation, whatever. It never interfered. So he retired. They sent me to a nurse practitioner who we spoke briefly, and she asked my history, and I told her had been diagnosed with bipolar 2, and she said, I don't see bipolar at all. Like, that's fine. Okay, you're talking to me for like 5 minutes, but that's okay. I don't mind.
Oh, how do you
And then
know?
and then she turned around and said, I'm prescribing you lithium. Now, lithium is the gold standard for bipolar 1.
Bipolar. Mm-hmm.
For bipolar
It's a
1.
mood stabilizer.
It is a
Yeah.
mood stabilizer. Yeah. And if people can tolerate it, it works fantastically. And I just like, why in the world would you prescribe me lithium if you don't see any symptoms? That don't make no sense. So I have Kaiser Insurance. I called them and I said, I didn't feel heard. I didn't feel listened to. I want somebody else. And they said, well, you shouldn't have had a nurse practitioner in the first place. We're going to give you a psychiatrist. So I went to a psychiatrist and she asked me if I've ever had any eating disorder. No, she said, you've never had eating disorder issues, have you? And I said, oh, yes, big time. Big time I have eating disorder issues since I was 14 at least. And she goes, okay. And she prescribed me for anxiety propranolol. I read the little fact sheet. I do that. I read the contraindications and all that. And it said one side effect might be weight gain. So
Nope.
the next appointment I had with her, I literally started with the appointment with, you either weren't listening to me or you didn't care what I said. And she's like, what?
Mm-hmm.
Why? And I said, if I tell you that I have really bad eating disorder issues, why would you prescribe me something that will make me gain weight potentially? She said, well, it's just such a small side effect. It doesn't usually happen. It's such a low dose. And I said, that's not the point. If that was the case, you should have explained that when you were prescribing. So I was not happy, but we talked it out. She retired, or I don't know if she retired. She went on maternity leave and then came back and then left. So Kaiser told me I needed to keep up my mental health stuff, the ability to go to therapy when I need to and all of that. I needed to have another psychiatrist. So that's what this appointment was today. When he came on the Zoom call, he asked me why I was there. And I'm like, it's kind of have to be because I need to continue my mental health. And I was telling him, he asked me about anxiety. And I said, yes, because I have been diagnosed with generalized anxiety disorder.
So is that why you were there? Is so you can get your medication? Like, really, what was the purpose of the psychiatry appointment?
To kind of keep my mental health going. Because mental health, there's wait list. Like even now for a follow-up appointment, I'm on a wait list. And I didn't want to have to redo everything if I just wanted to go to therapy again. I wanted to be able to call and say, hey, can you refer me to therapy? And they can. without having to first go to the psychiatrist. Because with Kaiser, you have to go through a psychiatrist to be able to go to a psychologist. So I
Right.
didn't
Okay.
want to have
Okay.
to do that again. I wanted to be able to call the psychologist if I needed therapy, because there is no shame in therapy. And I have been to therapy when I've needed it. And I want to be able to call up and say, I need therapy without having to go through all of the hoops again.
I will say what makes you a really good clinician and a really good therapist is the fact that you go to therapy, because this is what we all go.
Yeah.
We don't ever stop going. We don't ever healing. And in order for us to stay actively good in our jobs, we have to keep ourselves in check. And there's blind spots we don't see within ourselves. It's why having supervision is really important, and having another perspective and being like, oh, I totally somehow missed that about myself, because that's called being human. And so in order for us to be good at our jobs, we do have to keep our own mental health in check. And this is an incredibly difficult line of work, right? You run into empathy burnout. My sister is on medical leave right now, and she's a clinical therapist as well. And she's got a brutal anxiety disorder. She's got major depressive disorder and anxiety, and she's now having to up her medication because she's literally burned herself out so badly that now she has to take a couple months off work. If
Yeah.
we don't, the self-care and the check-ins, if we don't do this, this is what can happen. Then you add something like having a mood disorder that you on top of it. And and Jody, I have to say, I mean, I've known you for a few months now, or more, almost a year, I believe,
Yeah. Over
around
a
there,
year. Yeah.
over a year. And I just see you as Jody. I don't even, and I know symptoms of bipolar, but I mean, fuck, I talk a lot. Does that make me bipolar? No.
See, here's the thing with bipolar, that not you, I'm not saying you, but that people think bipolar is you're up, you're down, you're up, you're down, you're up, you're down, you're up. It's not like that. Your
No, it isn't.
baseline is baseline.
Yeah,
And
yeah,
you
it
may
is.
not have an episode for months, or you
No,
may rapid cycle and have a few in a month.
no. You
When
know what
I
most
work,
people say to me? Oh, sorry, go ahead. Keep
no, go
going.
on, go on.
No, no, no. I interrupted you. That was
When
rude.
I worked in the prison and was in a toxic relationship, I cycled more because of the toxicity. I
Yeah,
was in depression a lot more. And then I
yeah,
would come out and it was such a relief. I would get a migraine, but it was such a relief to
yeah.
feel normal. Now I wouldn't come out and go into mania and then go into depression and go into mania. No, I would come out and be like, okay, now I feel completely functional. Like I like people again,
Right.
figuratively speaking. But then manic episodes were nice, were fun because it's hypomanic. It's a little
Mm-hmm.
extra energy. It feels good. I don't know how to explain
Mm-hmm.
that. I'm not
Mm-hmm.
saying it's the best thing in the world, but it's hypomania. It's not I'm going to fly all my friends. I'm going to empty my bank account. We're all going to fly first class to Paris. Everybody loves me. We get to Paris. I have zero money. And now I crashed. And none
Yeah,
of my friends like
that's bipolar one. Yeah. Again, but a lot of people think with bipolar, this is the funny thing when people say to me, oh my God, that person's so bipolar. They're up, they're down, they're up, they're down, they're up, their
That's
emotions are all over. I'm like, no,
labile.
that's borderline.
No,
That's
that's
labile.
labile.
That's more borderline here. But labile is borderline. Labile is like where you're up and down, up and down, up and down, moment to moment, minute to minute, hour to hour, where you can go from such a rapid shift of depression to self-loathing to happy to sad. It's
Well,
crazy. And people, person's bipolar. No, bipolar doesn't work that way
I had a
at all.
supervisor who, when we had staff meetings, we would laugh. Well, not laugh, but I mean, it was like the four seasons. We'd get crying, we'd get laughing, we'd get yelling, we'd get, oh, everything is just fine, normal. We would get all the seasons you can get in one staff meeting. We were all like, okay, almost like a bingo card. What mood are we going to
Mm,
get this time? She was
I
so
know.
labile. I
Yeah.
didn't see borderline in her necessarily, but again, different. You can
Mhm.
act certain ways in certain settings for a certain amount of time if you need to. So you could be
Mhm.
labile.
Yeah.
Not
With
it's like
borderline, you,
borderline, you'll be labile.
yeah,
Labile
you are. Yeah.
doesn't
Because
necessarily
in
mean borderline.
Europe, no, but in Europe, they don't even call it borderline personality. They call it emotional dysregulatory
Yeah.
disorder. It's an emotional dysregulation disorder because that really is what identifies borderline personality, right? Or the dichotomous black and white thinking and the splitting. But you can also, with bipolar, there can be some crossover. People get them confused, or often people can be diagnosed with both. There's so much crossover in mental health. But I feel like we're digressing a little here.
That's okay.
Back to what Jody, we always do this, right? We get so excited when we talk about all these, it's easy to get off topic. But really, I think the most important thing to remember is that we're not a label, we're people. And
And
for you to experience somebody who is educated, you guys both have a very similar background. I mean, you're both PhDs, you're both doctors. Okay, he's a medical doctor, whatever. But it's so dehumanizing when somebody keeps saying, and they're not listening to you, I don't want to be on medication. So Jody, what's your reasons for not being on medication?
okay, what he said to me, let me give you just a little bit of background because I am not, I'm transparent just like you are. I don't mind saying this. I was telling him about my history and I said to him, I get anxiety. I know what I have anxiety over. It's not about not being able to pay bills. It's not about whatever. My anxiety is my son just turned, I'll probably get teary-eyed right now. My son just turned 22.
Yeah.
My birthday's
Mhm.
next month. I know based on lifespan that more of my life is gone than is ahead of me. Yes, anybody can go at any time, but I know I don't have as much time left. So I worry about my son. I worry about him because he has special needs. Is he going to be okay? I worry about not being here. And I got teary-eyed. And this psychiatrist said that was my unmedicated bipolar 2 that I got teary-eyed. That was depression. The reason I got teary-eyed.
That's
I'm
crazy.
teary-eyed right now.
I'm teary-eyed right now. You telling me this makes me teary-eyed because this is just a very normal response of being a mother to a special needs son. And again, you had your child when you were a little bit older, right? So with this has nothing to do with revealing age, but you know, when we're older, right? I've got 3 young children. As mothers, when you become a parent, not even just mothers, even fathers, right?
Yeah, my
We're
sister
supposed
has a
to,
friend who is a
our
man.
children are supposed to outlive us. That's the idea. But then when you've got a child that's sort of dependent on us, then what? It's
Yeah.
scary. And these are real emotions that everybody goes through time to time that thinks about it. And any mother would get emotional. This has nothing to do with a mood disorder or or your
No.
mental health. This is what I'm saying. This guy was so fucking offline, like just out of line, completely
And my
not okay.
my mom passed away at the age I am right now. My mom
Okay, so
passed away
okay, there's the
2 months
trauma.
before her birthday. It
There's
was
the
1 month
trauma.
before my birthday.
Okay,
Oh
so
yeah, I'm like, wow. I'm like, no, this is
oh, there's the trigger. There's the trauma. This is what anybody would feel, including this dude. So again, you know, it breaks my heart, Jody, and I'm so sorry that you felt so judged and just that somebody kept going back to the fact that everything that you were sharing in that moment, you weren't seen as being a person, you were seen as being a disorder.
diagnosis. Yeah,
It's
like you're
disgusting. This is
tearful.
what keeps people away from mental health help.
He brought that up so many times. You were tearful. You were tearful during our interview. You're talking a lot. I've had to stop you talking because I'm trying to get the history in. I've had to stop you. And you were tearful. This is all bipolar too. I'm like, so basically what you're telling me is if I were on medication, I wouldn't care. I'd be fine. I wouldn't care if I'm going to die. I wouldn't care if my son's taken care of. I wouldn't miss the childhood little days that every one of my
That's
friends
bullshit.
did.
That's bullshit because guess what? I am on medication. Now I'm not on a mood stabilizer, but I'm on an SSRI. Lexapro, Cipralex, escitalopram, okay, if whatever name you know, which is an anti-anxiety drug as well as an antidepressant as well as an anti-compulsive like OCD, right? So it helps with all of those things, which I have all of. So Jody here has bipolar disorder. I have complex post-traumatic stress disorder, depression, anxiety, and past eating disorder with OCD tendencies. I think when we've been showing ourselves on these podcasts, and this is the beautiful thing that we are, is we're transparent. We don't give a fuck. We're not here to pretend to be somebody we're not.
And we're not
We work in the field
stigmatizing
we
mental
work in.
health. We're
No, but we
showing
work
you.
in the field we work in is because we are all human and we openly admit that learning about this is learning about ourselves and trying to cope and deal with that's why we do what we do. And every single person is on a spectrum. Like, I'm only OCD in one area of my life, and that's my eating habits. It's not even really a formal eating disorder. I don't have anorexia anymore. I don't fit the criteria out of the DSM. I fit the criteria for OCD of ritualistic eating patterns to keep control when I don't feel like my world is in control. You know, I've had very similar experiences as Jody has, not quite to this severity of seeing a psychiatrist, which keeps labeling me with something. If anything, I was fearful I had borderline personality because my doctor saw me at a crash at one point, and knowing that I had anorexia, kind of linked the two and went, "Oh, do you know anything about BPD?" And I was like, "What's that?" And this is, again, I was just like, "What?" And then my sister, who's also a clinician, she's like, Brie, you've had so much trauma. You have complex trauma. And I'm like, okay. So then I started delving into it. And then I went and saw a therapist, and she sort of said the same thing. She's like, yeah, you got some traits going on. And then I was like, oh my God. And even when I first met Dr. Larman, I'm like, do you think I'm borderline? And she's like, no, I don't see any BPD there.
I
And
see
so again, I went,
PTSD. Yeah.
right? PTSD. I went to a psychiatrist, and I literally, because I was determined, I'm like, maybe they'll give me a different answer. Excuse my dog barking. And you know what he said to me? This goes to show again about sometimes it doesn't matter what your fucking degree is. It doesn't matter what your education is. I'm no fucking doctor, but the first thing he said, he's like, do you self-harm? And are you suicidal? And I said, I've never been suicidal, and I've never self-harmed. And he goes, you're not borderline. The end.
Yeah.
Bye. 10
What
minutes.
what
10
I've
fucking minutes.
noticed a lot of psychiatrists and psychologists, but a lot of psychiatrists, with all due respect, because we continue to take continuing education and talk to do therapy, that I had a psychiatrist say to me, someone told me they had CPTSD. Is that even a real thing? I'm like, yeah, it's a real thing. Hopefully it will be in the DSM, but since psychiatrists are the ones that write them, I don't know.
No, but here's the deal. Dr. Judith Herman, psychiatrist who runs or did run, not anymore because she's in her 80s, I think, ran the Department of Psychiatry at Harvard University, is the one that coined the term CPTSD. She's tried to get it in the manual. She's tried to get it in the DSM for years. But who does she work with primarily? Men.
Men.
Male psychiatrists that
And
literally treat Jody exactly the point that we're making. It's an
yeah.
old fucking boys club.
And here's the thing, the main reason, this is what I can see, and this is what I tell my clients who have said, I think I'm borderline. They told me borderline. I'm like, you have CPTSD. The emotional dysregulation. There is emotional dysregulation as CPTSD. And so as soon as someone sees that, sorry, but yes, this is sexist, typically a male psychiatrist. Not always. There are females that don't understand it as well. But as soon as they see this emotional dysregulation, it's like, oh, yeah, it's borderline. And borderline borderline dysregulation happens in any and every setting. It is not
Yes.
right.
Pervasiveness. A personality disorder, it has to be pervasive in all areas of your life. I don't have those issues. I hold jobs, no problem. I hold friendships, no problem.
Yeah.
Now, my romantic relationships, I attract narcissists
That's
or
the thing.
dysfunctional men. That's where I
Emotional
become
dysregulation is in
dysregulated.
the interpersonal, typical
Yes, it's in,
romantic relationship.
yes,
Yeah. And
I
it can
struggle.
happen with
But
friends, because if you're
yes,
being triggered by something with your friends because you feel comfortable with them to the point of discomfort, if you will, so that emotional dysregulation. But it doesn't happen to the
I
grocery
don't,
store if someone cuts you off in line. It doesn't
no,
happen if they don't have the right cut of meat.
no,
It doesn't happen if you're,
no, I
you
don't.
know,
No, no, this is the thing. Like, even my friends, if I don't agree with them, I'm more of a passive person. I'm like, okay, I'm just gonna, I don't cause, there's no chaos there. It's just, again, because I attract abusive men. And so it's triggering the abuse cycle and the CPTSD and the trauma. And then I have, I struggle in those relationships. But for people to label, that was my biggest fear, is that I have borderline personality. And I was like, holy fuck. That's the most stigmatizing personality disorder to have. It's worse than NPD, because
yeah.
every mental health professional from the 60s writes off people with BPD. They just go, fuck, don't even touch that with a 10-foot pole. It's the most misunderstood diagnosis. And I have clients that have it. It's fucking heartbreaking. For the most part, it's usually trauma related. But the same thing with bipolar. People can get them mixed up because a lot of the symptoms
Yes.
can be very, so I have a friend that's bipolar too. And she doesn't represent, like, she is medicated because she doesn't sleep. So she struggles with her sleep when she's manic. And
Yeah.
she's on, I think she's on Wellbutrin and an antipsychotic, I believe. But other than that, and you would never fucking know. But I have to say, Jody, you're unmedicated, and I would never know that
And
you have
here's
bipolar
the
2.
thing that the psychiatrist kept asking me, why do you not take medication? And this is what I tell my clients. And as a psychologist, because I don't prescribe, this is what I 100% believe. If it is not affecting your emotional or your occupational, your, why am I drawing a blank? Your social, emotional,
Interpersonal.
occupational functioning. Oh my God. So sorry. If it's not interfering with your social, emotional, and occupational functioning, then it's okay.
Mhm.
You don't need medication. If you're going to therapy, if you're learning the tricks, if you're learning the tools, I have managed this with no problem. People, there's some people that are like, you don't have it. And there's other people like my inmates at work were like, oh, that's you, Dr. Larman, whenever I would explain the difference between bipolar 1 and 2. So I have
I
held a
think my dog
job.
got out. I don't mean to interrupt. I'm just talking. My dog, I think, got out, and I don't know where she is.
Oh
So you
no.
just keep going.
Are you sure I can pause?
Yeah, she did. She totally got out. Nope, nope, don't pause. I got her.
Okay.
She's just out eating her grass.
Okay. So
Always entertaining on why you can. I complain when you can whine.
and this is raw,
Doo-doo.
authentic. This is
Keep going, Jody.
unedited. This is great. So if it doesn't interfere
Oh
with
my
your
God,
social,
unedited raw.
occupational functioning, and it doesn't cause you distress or the people around you distress, I have to say.
Yeah,
So, because with personality disorders,
yeah.
it might not cause you distress, but it causes people around you distress. So, this psychiatrist kept asking me
Oh,
why
it does.
I could not take medication. And I said, because I don't need it, because I manage it. Because honestly, as a psychologist, I use all the tips and tricks and techniques and everything that I teach to my clients. I utilize them
Yeah,
every single day. And he said, have you ever taken medication? I
yeah.
said, yes. Every medication that I've taken, medical medication, 99% of them make me either scratch my skin off or want to vomit, puke, can't lift my head, I'm going to die. It's horrible.
Right.
And he said, yeah, but what psych meds? And I said, when my husband died, this is a big one, dude. When my husband died, I was prescribed Celexa. And for the first time in my life, I had suicidal thoughts on it. And after a week of it,
Is
I
that Zoloft?
no, it's Celexa. It's
Which
a
one is Celexa? What's the other? What's the
I
drug
don't
name
know
for that? What's the
I don't know the brand name I only know the brand name of it, to be honest with you.
Okay.
This was a while ago. So I said, I can't take this. I told a friend of mine, this is making me feel suicidal that I wasn't feeling before. And I stopped it. And then I took and I told the psychiatrist that, and he said to me, yeah, but that's not prescribed for bipolar. And I'm like, it was prescribed because my husband died. And then
Yeah, it's not.
and then I took Effexor, which I couldn't even lift my
Oh,
head. I worked an hour and a half away on a good day from where I lived at the time. I could not. I was like, how the hell am I going to get home? This is bad. And he said, yeah, but Effexor is not for bipolar. As a matter of fact, if you're bipolar, you should definitely not take Effexor because that will flip you into a manic episode. A lot of people, just a little side note, a lot of people who were diagnosed as depression, major depressive disorder, and then were given an antidepressant only to find out it flipped them into a manic episode and they were actually bipolar and didn't know.
oh, yeah,
So
because you can't go necessarily on an SSRI. You've got to be on a mood stabilizer.
and Effexor is one that will, if you are especially bipolar 1, holy crap, it will flip you overnight into a bipolar 1 manic episode. I have seen it. I've seen
Scary
it
because
happen.
my mom and my sister have been prescribed. It's the worst medication. If you miss a dose, you're so sick and you can have brain snaps.
Brain
My
zap.
mom was
Yeah.
suicidal coming off that med, and
Yeah.
my sister, hardcore spiral when she was on Effexor. It is the worst. I don't even know why they prescribe it
But
anymore.
if
It's
it
terrible.
works for people, it works for people. But I told the doctor, I said, so I took those and he goes, well, those aren't for bipolar. I'm like, if I'm going to get very sick or scratch my skin off and feel worse than when I'm off medication, why would I want to keep trying? I don't want to try medications. I am fine. I'm good. And so everything that I said after that was that all of my issues, all of my problems, all of my anxiety, all of my body dysmorphic disorder, all of my eating disorder issues are because it is unmedicated bipolar disorder. Everything that I said, because it's unmedicated bipolar disorder. I was so angry. I was so angry. He kept calling me Miss Larman, Miss Larman. And I don't care. You don't have to call me doctor. Even my clients don't always call me doctor. When I worked in the prison, yeah, the inmates had to call me doctor. But my clients, I had a couple clients say, what do you want to be called? I said, what do you feel comfortable calling me? I don't care. If you want to call me doctor, call me doctor. If you want to call me Jody, call me Jody. It doesn't matter. At the prison, a lot of people call me doc. I was fine with that. He kept calling me miss. And it's like, for one, I'm a widow. For two, I'm a doctor, not a miss. And he's like, well, he goes, I'll call you whatever you want me to call you. So at that point, I was like, call me doctor. I don't care, but because you're so demeaning and so degrading and so devaluing, you need to call me doctor. Because people I don't
Because you're demanding respect. That's why.
yeah.
I mean, at any point
You're
in
not giving
time,
me any.
he's dehumanized you the
Yeah.
whole 40 minutes. And then he's not even calling you by your name. And this is just it. If you have a respectful person, right?
Mhm.
Yeah, you're a humble person. It's not about that. But when somebody is degrading and honestly dehumanizing you the way that he was, and he kept repeating it over and over and over again, and you're not shy and you're not scared to challenge somebody.
No. No.
This is where you and I are a little different. I, on the other hand, would have just, ooh, I'm a little mouse, right? Like I would have cowered. I probably would have been like, ooh.
Well, I tell my
But
clients, I am a huge advocate of speaking up and being heard. And when you are in your therapy appointment or a psychiatrist appointment, you need to be heard. This is your appointment. You are in charge, not them. And if you don't feel heard, you need to find someone else. Well, first, I think you need to say something. Don't be afraid to say something. And then find someone else. And it's hard. It is hard. I get it. Because even me, I felt like, what the hell's happening? What is going on? Why is this happening? Oh my God. I started to feel like literally shrink up into this little what in the world. So I get it. But I am a huge advocate for no, you are in control. This is your life. This is your mental health. We're all human. We are all people. They are not better than you. You are not better than them. I'm not better than that psychiatrist, and he's not better than me.
Well, this is just it, because you're all people at the end of the day, regardless of your expertise. And okay, it's a lot different if you have somebody coming in and telling you how to do your job. I mean, I did talk to a psychologist once, and she said, usually when I've got dealing with personality disorders, I'm sending them over to the DBT clinic right away. And I'm like, why is that? And she goes, because they're already within 10 minutes telling me how to do my job. Like,
oh, yeah. Okay, that's different.
oh,
that's different.
So, that's different, right? But again, it's not about that. But I mean, honestly, how dehumanizing, and why do you think there's such a stigma and a continued stigma around mental health is because you get people like this. Now, as a person who works in the service industry to people, which we all do, and we have varying levels of that. I'm not a doctor. I don't have my PhD. I mean, I could, but at this point in time in my life, I've got 3 young children, and that just wouldn't make any sense for me because I can't get those years back, right? For me to go to school, why? Just so, I would be doing the same thing. Yes, I'd be paid a little bit more, but meh. At the
The
end of the
reason for
day,
going
I've
to get
found,
but really quick, Bree, the reason for going to get your PhD should be that I want that more knowledge and more ability to do research and expand and all of that. It should, I know people that want to get their PhD just to be called doctor. And that is not
that's the saddest part about that designation, is because a lot of people do it for ego. They do it because they don't feel good enough. And they're doing
and
it
you
because
won't be called doctor half the time. I'm going to tell you that
yeah,
right
well,
now.
there you go. Again, people that demand that is because you're doing it for the wrong
Yeah.
reasons. But again, this is what the saddest part is, like, again, the psychiatry and the old school. And I look at I mean, I've seen video and school and training and all the saddest thing I will never forget, I think when I was doing, who was it? Was it Carl Rogers or nope, it was Bessel van der Kolk. Okay, so Dr. Bessel van der Kolk, same thing, psychiatrist, trauma, worked with Dr. Judith Herman for years at Harvard University psychiatric psychiatry department. And he said the saddest thing back in the 60s as an intern psychiatrist was that he was dealing with women who had what used to be called hysteria, which we now know is PTSD, right? And
Or
complex
depression,
PTSD and trauma,
or yeah.
right? And he said the shittiest thing is that all they needed to do was talk. And after the session, so this is where talk therapy was sort of invented. They just needed to talk and for somebody to listen to them. And it was a man listening to them. And then they would feel so much better. But then they'd have to go for shock treatment, electric shock therapy. And then they would forget everything. And they wouldn't remember the conversation he had. He said, it was the hardest part of my job. It's what didn't make any sense to me. But back in those days, again, we evolve as humans. We're learning all the time. We're changing. But people were treated like lab rats, right? You weren't even treated. And this is what has been so stigmatizing about mental health from the beginning of time. My grandmother, who had a major somatic disorder, she would be considered Munchausen's, right?
Oh, wow.
She literally was put in to the local Lower Mainland Psychiatric Hospital because Victoria, where I was from, Vancouver Island, which is off the mainland, didn't have a psychiatric hospital back then. So she was sent to the main one on the mainland, and it was old school, like creepy old psych hospital in the 60s. And for my grandmother, who was starving for attention her whole life, who would always embellish and make shit up and just fabricate everything, she didn't fabricate this, and she didn't even want to talk about it. And anytime she could get attention from anyone, she would. And the one time where she told me she did, and the vacant look on her face when she said that she had to go stay at that hospital, she said it was awful. They literally would tie you up with other people and they would walk you, and then the electric shock, and women especially, right? It's dehumanizing, and that's what it was back in the 50s and the 60s. And psychiatrists did treat you like you were not human. It was awful. And this was what makes me so mad now.
Yeah.
We're in 2024. Excuse my French. This is where we like to swear because we don't care. This is what it's therapy, right? Your wine, your liquid
My
therapy in a
liquid
glass.
therapy.
In a glass, right?
That's another thing that he asked me about. He said,
Oh
how much
yeah,
do
you're
you
drinking.
drink? And I said, well, I have a podcast on Mondays called Why Complain When You Can Wine? So we'll drink, a glass of wine. I said, other than that, I really don't drink that much. Maybe a couple times a week. Maybe I go weeks without, but it's no more than one drink because I really don't like to drink because I had alcohol poisoning when my husband died that I don't like to drink anymore. And he goes, what do you mean you had alcohol poisoning? Was it bad alcohol or you drank too much? I said, well, when my husband died, like 6 months later, I think it was, I got in an argument with a friend. So I drank a 750 milliliter bottle of vodka. I said, I wasn't trying to kill myself. I wasn't trying to hurt myself. I just didn't care. I just drank it. Nope, that was my unmedicated bipolar 2, he said. It's like, no, it was my husband died. Now, anybody that's ever lost a spouse.
The worst grief you'll ever go through in your life other than a child.
And it changes. Your status changes from a we to a me. You had these hopes and dreams in life with your partner to no partner, no hopes, no dreams. So yeah, I drank a fucking bottle of vodka. Am I happy about it? Absolutely not. No, but I ended up in the hospital, police, ambulance, whatever, with a 0.27 something alcohol. I'm lucky I'm alive. But it's like, dude, when you I guess the whole point, and we're getting close to the end, but the whole point is one, stop freaking stigmatizing mental health because that's what he's doing. When you label everything that goes on in your life is due to a mental health issue because you don't want to take medicine. No. Okay, so first off, going to therapy is treatment. You don't need medication for everything. I've told my
Mhm.
clients, and you may not agree with this, Bree, and that is a-okay. I tell my clients, you should be medicated for pretty much life with bipolar 1, bipolar 1, and schizophrenia. Those
Oh,
are the
100%.
only two that are an automatic, don't go off your medication, please. And I know antipsychotics suck. They don't make you feel good. But with bipolar 1 and with schizophrenia, you're going to need medication for life because therapy alone is not going to help. However, and I had an MP, a psychiatric MP go, they don't need it for life. Like when you're 80 years old, you might not need it. And I'm like, oh my God, okay. Well, now we're getting technical. So for up until you're 80, let's see what happens after 80. I don't know. But for the most part, all the other ones, if you are going to therapy and you are learning tips and tricks and you know how to do it, just like with DBT therapy and borderline, if you work on it, and it is work, trust me, I utilize my tips, my tricks, my techniques, everything I teach my clients, I utilize on a daily basis.
So do I. Yeah, so do I. Yeah. You have to know,
Yeah.
right?
Then you may not need medication. Or if you cannot utilize the tips and tricks and techniques, go on medication. Get to
Mhm.
that point. Get to that point where you feel, and it could be weeks, it could be months, it could be years, but get to that point where you feel like, okay, I might be able to do it on my own.
Mhm.
And again, that's going to vary for everybody. But I have heard and seen too many people who go on an antidepressant or go on a mood stabilizer and never go to therapy because
Mhm.
they're going to stay on it for life.
Yeah.
And that's just a band-aid. So for him
It
pushing,
is.
pushing, pushing, pushing me to take medication, saying that it's my untreated bipolar, it's like, dude, it has not affected, again, my social, emotional, occupational functioning. I have an extremely high credit score. So I'm not impulsive and blowing through my bank account, which is a symptom of bipolar 1. I have held a job. I've never been fired. Knock wood. My last job was 13 years at the prison. I left because I was medically retired. These are the things that your clinician should really go through your biopsychosocial history well. But I am the first person to, when I have a client that is just not able to do it, to send them to a psychiatrist for a medication eval. I'm not against medication at all. I'm against
No, I
medication
know.
without therapy. I'm very much
Yes,
against medication without therapy.
I know. Yeah. Well, like you said, I mean, I have clients where they refuse to take medication and it blows my mind. But no, like, but they need it. This is what I'm saying.
Oh,
And I mean, I run a
yeah,
holistic health business aside for along with being a therapist. I'm all about holistic measures.
yeah,
If you can use them and utilize them, there's some things where there's just literally brain neurotransmitter imbalances and you need to
yeah,
be on medication. But
yeah,
people who refuse to take it because they think that like it means that they're flawed or that they can't, and they're choosing to suffer. They're doing therapy, but the therapy isn't enough because they can't
yeah.
regulate
Mhm.
neurotransmitters in their brain. You're at a lost cause. I know people who have, like my sister, cannot be off medication. She is literally massive, major, and such a brutal anxiety disorder along with it. She's been suicidal. She can't. And when she's on her meds, she's fine.
Does she
Totally
go,
fine.
I know she's a
It's
therapist. Does
not,
she go to therapy?
she just started to. It's taken her a
Oh,
long time to
good,
get there. But I mean,
good.
medicine has been enough to actually help her. It's where she has to go.
Yeah.
She's increasing her dose, but that's because she's empathy burnout, right? And in our line of work, she works in eating disorders
Oh,
with teens, not just
I,
adults, a lot different, but teens, you're dealing with families. So it's very complex. And you're at a loss because usually a lot of the cases with eating disorders, it can come from dysfunctional families, right? So she sees a lot of dysfunctional parenting, and it's a tough job. Our job is hard, but the biggest thing that we're trying to get away from is the old school mentality. And psychiatry, I feel, not all of them. I know some beautiful, amazing psychiatrists out there. We can't just label psychiatrists as being bad because
no,
they're
no,
not.
no,
You
no.
had a
No,
and
I send people to psychiatrists. I believe in that for a
yeah,
reason.
Yeah.
But
Yeah. Yeah. Yeah.
I think
But
that,
I mean, again, there's bad apples everywhere. I
yeah,
had
yeah.
a psychiatrist, social worker who is my therapist who wound up hitting on me. Like literally, like after my ex-husband and I stopped seeing him and I started seeing him on my own, he made some pretty fucking inappropriate comments. And I thought, and then he played it up that he was part of the women's rights movement through UBC, which is the University of British Columbia. And I was just like, oh wow, so you're so manipulative, and he was grooming. And I was just like, again, psychopaths, sociopaths, all of them can be doctors. In fact, if you look at lawyer, and I hate to say people out there who are lawyers and doctors, great, but there's a high level of narcissism that runs in
Because
these
you have to
businesses.
climb the ladder. You got to climb the
They
ladder.
do, and you
On
have to
the
have an
top,
inflated sense of self and importance
yep,
and all the rest of it. So you
and
see
not
it.
willing
It's
and willing to
common
step on people to get there, willing to use people to
to
get
get
there,
there.
to
And
manipulate
we're
people to get
working
there, to exploit
about
people to
building
get there.
people. Yeah, and helping people. Now, you'll see medical doctors all day long that are book smart that have no fucking bedside manner. And that's where they need to have a bedside
Yeah.
manner because people are not well. And in mental health, again, the reason why people won't go get mental health treatment or go to therapy is experiences like what Dr. Lerman just
Yeah,
experienced this
I've
morning.
heard
And she's a
it
full-blown fucking psychologist.
way too many times. I have heard so many people say to me, I don't go to therapy. I will never go to therapy because I had a bad experience. Now, there are bad psychologists, there are bad master's level clinicians, there's bad anything in every profession. However, the vast majority of the time that people have told me they've had really bad experiences and they don't ever want to go to mental health, sadly, it's been a
Mhm.
psychiatrist. And I tell them, go to a therapist. You need a full biopsychosocial. Not every
Mhm.
psychiatrist does it, but every psychologist or every mental health clinician should do a full biopsychosocial. That is part of our intake. And again, I'm
Mhm.
not saying that all psychiatrists are bad. However, I've come across way too many because they don't do therapy. They diagnose so that they can prescribe,
Mhm.
because otherwise,
So
why do
bottom
you need them?
Yeah, exactly. Well, bottom line is, folks, if you need a psychiatrist because there's medication that you need and
Please
you need
go.
a diagnosis, then yes. But I mean, at the same time, if you're not jiving with that person, find another one. Don't
Don't
stop.
be afraid. I tell people all the time, you're allowed to clinician shop. The best predictor of outcome of mental health therapy or any mental health is the rapport between the client and clinician. I had the
Absolutely.
psychiatrist today ask me why I didn't want to take the medication one of the nurse practitioner prescribed for me. And I said, because it was out of spite, because I didn't feel heard. I didn't feel listened to. So I went to someone else.
Hmm.
So that shows you I wasn't complying because I was pissed at her. And
Yeah,
I'm a
exactly.
clinician and I know better. So the best
Yeah.
predictor is outcome. Keep going. Don't be afraid to clinician shop. Once you find that person, be it psychologist or psychiatrist or any mental health practitioner at any level, once you find that person, it is
Mhm.
literally life changing.
Yeah. Oh, it is life-changing. 120% it is. But just don't give up. If you have a bad experience or you feel like you're being stigmatized or people aren't seeing you as a person first. Now, here's the deal. In mental health, the only reason why there's a diagnosis is so that a practitioner can
Insurance
formulate the proper treatment plan. Yeah, proper treatment
and
plan
to
and
bill
insurance.
insurance. Because you can come up
Yeah,
with
well,
a
yeah.
treatment plan without a billable
Yeah.
diagnosis. But we have to, at least in the United States, maybe not in Canada,
Mhm.
but in the United States, we have to have a billable diagnosis. So I'll tell my clients, look, for some of them, this is the diagnosis I'm giving you. I want to let you know why I'm giving it to you. I always explain, anyways. I'll tell people why I'm giving them the diagnosis I'm giving them. But when it's something like you really just have a mood disorder, they come to me because something happened in life, whatever, it could be an adjustment disorder or a mood disorder. I'll tell them, look, it's very minor. Don't be worried, but we have to bill your insurance.
Mhm.
We're going to treat you the same
Mhm.
way, whether you have a billable diagnosis or not.
Well, exactly. But really it's for the clinician. It's not for the people. the DSM exists only so that you basically follow a group of symptoms that you classify as a certain disorder so that the therapist or the practitioner knows how to treat you. So I'm qualified to treat most. The only things I don't work with are unmedicated bipolar 1 and schizophrenia. Because honestly, I've had a client, like when you're dealing with full-blown psychosis or delusional disorder, it's impossible. Like there's just nothing you can do. Like you literally, if that person's not going to take an antipsychotic, you're fucked.
Well,
So they're
disorder, the medication is for different things with a delusional disorder because it doesn't help
it
the
is.
delusions. Nothing will.
No,
Honest.
no, it does, and it doesn't work. But that's the only thing that I won't do. If they're medicated, no problem.
Yeah.
But you know, everything else, it's again, the treatment, a lot of these therapies and the modalities are the same, and they run sort of across the board,
Yeah. I
right?
used
You're
to tell
dealing
my
with it's
inmates,
because
I'm so sorry. I'm so sorry.
oh, that's okay, you're inmates. Yep, no.
I used to tell my inmates because they'd have one diagnosis from the psychiatrist, which was usually schizoaffective, because you can do antipsychotic, antidepressant, mood stabilizer with that diagnosis. So I would tell my inmates because I'd give them a different diagnosis. And I said, look, the diagnosis is more important for us. We're going to work on your
It is.
symptoms regardless.
It's only for the clinician. It's not for the patient. So
Yeah.
really telling you what you have is almost pointless because again, it's stigmatizing and then people then have to deal with more self-worth and more
Yeah.
self-esteem issues
Yeah.
rather than being able to feel like they're just a human being. So again, 2024, full-blown psychologist goes to a psychiatrist and gets treated like a lab rat.
Like a
And it's
dehumanizing,
really
devaluing, demeaning, and oh my God, I'm bipolar
and
too. My life is a mess because of it.
I know.
Uh,
It's not because you function just fine. And had you not told him that you were bipolar too, this is where I'm really curious.
yeah.
What would he have said
Done.
your issues were?
Yeah.
Because he kept going back, oh, it's because you're not medicated. Oh,
Every
that's your bipolar. That's your
time.
bipolar. No, that's just fucking yeah.
He
Yeah, I
even
know.
told
And it's not
me
okay.
he tried to explain what anhedonia was to me, and I'm like, dude, I know what anhedonia is. You don't have to explain it. So
Yeah, well,
we are at
okay,
the end. We do have to wrap it up. We
you do.
will continue. If you really, I would love to talk more about this. If you guys are more interested, please like, comment, share, subscribe. But if you want to know more, send us wcwycw1@gmail.com. You can email us. You can write it in the comments unless you don't want other people to see. But one thing is, and I guess this is one of the main points, you are not your diagnosis.
You're
Your
not. You matter.
diagnosis is not who you are.
No, it isn't. It does not define you.
No.
Okay? It does not, your job does not define you. Your diagnosis does not define you, right? We as a culture have fucked up the human race 120%, right?
And it's that way for even medical diagnosis.
Like,
We are not, I think one of us froze. We are not our diagnoses. Like I'll say I do say I'm bipolar 2 only because it's easier, but it's like I have the diagnosis of bipolar 2. But I'll just say, yeah, I'm bipolar 2. I don't care. I had someone ask me, a clinician, say, why would you tell people that? Why not? It's who I am. It's part
and
of
I'm just gonna add this. The more transparent you are as a clinician, especially at the level of a PhD, the more people respect you. If you know Dr. Marsha Linehan, who is the founder of DBT, dialectical behavior therapy for borderline personality disorder, she didn't come out with her story until 2011 when she did a public appearance and a talk at the psychiatric hospital she was admitted to when she was 17 years old. And they threw her in there with a diagnosis of schizophrenia back in 1968 because back then, personality disorders, nobody knew what they were. Borderline didn't exist. And she had severe depression and severe self-harming and suicidal ideation, that she was deemed the most untreatable lost patient in the entire psychiatric ward. When she left that hospital and went off all the antipsychotic medication, she never went back on. But as she moved through her career, became a social psychologist and then a researcher, and then founded dialectical behavioral therapy, which is a cognitive therapy, and is the only one to date that treats borderline personality disorder and highly suicidal and self individuals because of the way that it's formatted, because that was her life. She said in this speech, I went to hell and I wanted to find a formula and a therapy or some modality to get people out of hell because I lived it. And she was a devoted Catholic for years. She was raised as a very, now she's a master. And she was told, so Otto Kernenberg, who's a very famous psychiatrist, German, old school, again, saw the self-harm, saw the scars on her arms, and said one day, have you been admitted into a psychiatric hospital? And she goes, and he goes, don't tell anybody. You're a doctor.
You know,
Don't tell anybody. It's you're gonna screw yourself because people are then not gonna respect you. And you know what she did? She said, the reason why I stood in front of all of those people, my family, and everybody at that psych hospital that day was because I didn't want to die a coward. I don't want to die a coward.
I'm
I
not
just
about,
listened to her more. It's fucking incredible.
I'm not about,
Yeah.
I'm not about
So she said,
stigmatizing. I'm not about glamorizing. I'm about, we are who we are. We're human. We all have issues.
well, we're human. The whole thing is that again, it's showing her being more human. And you know, after she did that, she was far more respected. People applaud her because people want to see real and vulnerable. They don't
Yeah.
want this, I'm a therapist, so I'm perfect. No, they want to know that we're all relatable. They want to be able to connect. The whole idea is that's why I don't hide behind a lot of the stuff that I have because I'm no better than anybody else out there. I've experienced the same fucking pain, the same shit. And that's what makes us real, authentic humans. And we're being honest with ourselves. And if people have a problem with that, well, that's their own deal. The whole idea with Marsha Linehan is that because she was such a respected, well-renowned, and again, coming from back in the 60s and working with a lot of old school doctors, and don't tell anybody, just keep that under hats, like because everybody saw that she had self-harmed. So they knew that she'd been institutionalized. And she just said, in the end, I don't want to die a coward. Yes, I would have had borderline personality disorder, but she created DBT. And she says, I don't live that way anymore. She's a Zen master, like literally, like amazing and funny as hell if you listen to her talk. She's so fucking real and she's so human. This is why I like Jody. When I met her, I'm like, God, she's a psychologist and she's swearing like a trucker on her social media platforms. And you know what? I had somebody call me out on that the other day. They're like, you're a therapist and you talk like that. I'm like, I'm a person,
Yeah.
dude. That's my
Yeah.
profession. And but some people
Are
still
you
do that.
fucking
And that's
kidding me?
fine. People
If
can
you
judge
work in
all they
prison
want.
and you
Yeah.
never cuss, I think there's something wrong with you.
Well, they do, but here's the deal. It's also very therapeutic, right? I literally think there should be a thing called swearing therapy or cussing therapy
Yeah, we
because it
all need
actually.
to fuck sometimes. It just fits.
So, on that note,
On that note,
we love you. Don't sacrifice your own mental health because you're worried about stigmatization. Go get the therapy and the treatment that you need, and don't let one person, educated or not, define who you are by a label because it's bullshit. The end.
advocate for yourself. Like,
Yeah.
subscribe, comment, all of that. Click the little bell, tell us when we drop an episode.
Yeah.
We'd love to hear from you.
You would. Thanks, everybody.
Take care.
Happy